Do you do it or flaccid?
So I will inject the patient beforehand with a little bit of Trimix. Trimix gives you what I call like an artificial. You do not need to be fully hard for this procedure. I just don't like men to be fully flaccid either, where they're like kind of hyper contracted. I always kind of say like I'm think of myself as kind of like a sculptor architect, and I like to visualize the full scope of what I'm working with. So I will inject them with a little bit of Trimix. We let it kind of kick in. I don't put a lot in there because I also don't want them to be rock hard. That can also make it challenging, but kind of in a chubbed up state is ideal. And so what I will do is I always kind of point out, like, if this is your penis, my nail bed is the glans, up here is the base. I'm injecting along the sides of the penis, not injecting on top of the penis, because penises, they can curve left, they can curve right, they can curve up, they can curve down, or they can be perfectly straight, but they are not dome shaped. So penises on top are flat, right? So injecting the penis on top with filler would distort the shape to be more dome shaped, more kind of sausage like.
Right.
And so that to me is kind of a dead giveaway that there's been an augmentation. So when you're being strategic and artistic about it, you'll just be injecting along the sides in order to create a really nice widening effect. And it will naturally kind of feather over a bit and kind of have more of a blended appearance. So there's nothing that sticks out to you. That's the best way to do it artistically. I will also kind of taper the effect more or less. So again, if this is the head of the penis, this is the base, because people are very cognizant of those bad cases where the enhancement of the shaft can make the glans look, the head, and make it look very small.
Yeah.
So you always want to put the most amount of girth towards the base and slightly create a transition zone towards the glans so that you're not distorting that proportion.
Okay.
Obviously, it's respecting the anatomy on the individual, and, you know, if it's all kind of catered to that person, but more or less, that's my intention, is to always kind of have a very transitional zone amongst it so that there's no like ruining the proportion of the penis.
Because you can't put it in the top.
You can put it in the glans. So I do it regularly for people, but I never like to do it on first-time patients because I'm very transparent when it comes to what to expect from these treatments. And so the glans is sponge versus when we're injecting the shaft, we're injecting subdermally, so below the skin. And so you really see a lot of your bang for your buck, so to speak. So whatever you put into the shaft, you see it. So it's a nice increase. Patients can appreciate the money that they're putting into it, and it feels well justified, versus the glans is sponge. So you really only see the enhancement of the glans when you're fully erect, because then you're engorged with blood and you're pushing on that filler that's injected along the outside. Even then, it's very subtle, and I'm still putting quite a bit of filler in there to get that subtle result. So I never like someone who is first getting this done, who, you know, it's their hard-earned money and I want to respect it, to feel like they paid a lot of money for something that wasn't as impactful as they would like.
Okay.
So I do offer it. I will do it on someone if they understand and they demonstrate that understanding, that it's not going to be a very impactful result, but yes, it's safe.
So when you're injecting the shaft, do you do one and then massage it, or do you do several and massage?
Yeah. So I inject with what's called a cannula. A cannula looks like a needle, but it's blunt tipped, meaning that it's not sharp. So you can actually bounce it off your hand.
Okay.
It won't cut you. So if this is the penis, this is the head, this is the base, it's all numb, so you won't feel anything. I'll poke a little hole with a needle and then slide on through with the cannula. The cannula being blunt tipped makes it extremely safe, meaning that even if there's a vessel that's in front of the cannula, it'll either move the vessel out of the way or you'll just bounce off of it and you'll have to wiggle around it. It won't pierce it, which is what allows you to prevent an intravascular occlusion.
And then do you have to massage it?
I will mold it right after I'm done with the procedure. So I'll mold it into place. I'll educate the patient how to continuously keep molding it. I tell them after 24 or 48 hours, they will be massaging their penis for 15 minutes a day minimum for 3 weeks until they see me for their follow-up in 3 weeks. And that's when I will let them know that they can discontinue massaging if I see that it's appropriate to stop.
And can you have sex straight after?
No. So I like to say 3 days of no hot tubs, no pools, no saunas. That's like all infection control. no masturbating, no sex for 3 days. After the 3 days, you're good. The ports are all fully closed, so the risk for infection is, at that point is not there. Masturbating can resume after 3 days, and as long as you're still doing your massages, that masturbating does not count as the massage because it's a totally different mechanism of how you're moving your penis. Sex, typically, you are fine to do it after 3 days in terms of like, you're not going to get an infection or anything like that, but I just don't think that it's practical. Most guys typically wait around 7 to 10 days if they have a partner to have sex. And if they're single, they typically wait around 3 weeks to have sex so that it's more healed. Just so that they feel confident with how everything's, feeling and going down there.
What happens if the aftercare isn't followed and you get a naughty patient that turns up and have sex the next day and they never massage it? What can happen?
If you don't massage or take care of your penis, then you definitely can get some lumps and bumps and irregularities. I always like to tell patients that I'm doing 90% of the work and they're doing 10% of the work. So if they want a fantastic outcome, then they also play a vital role in making sure that happens. In my clinic, there's a lot of education involved. I don't rush this procedure. I make sure there's ample time during the appointment to make sure that I'm educating you as well for before the procedure and as well as after the procedure. We also text patients the post-care instructions as well as a video of how to actually do the massages in case they forget. So really giving people all the tools that they need to succeed with it. Over time, you learn from your experiences with patients, and just like I learned from my experiences with myself and my own injection techniques, I'm learning how to always make sure that my messaging in regards to post-care is being conveyed and being received appropriately, and how to monitor to see if a patient actually really does understand it or not. That over time has helped me to have consistently higher and higher success rates of patients being able to perform their post-care appropriately.
And for people that don't understand the science behind it or what's happening, you can understand how the idea of how much a penis contracts based on temperature or how turned on you are or whatever. Personally, I'm like, where's the filler going when the penis contracts? Does it just clump together or does it go into the body? Well, where's it moving to and how does it stay so smooth? Do you know what I mean?
Yeah, I think actually it's kind of the opposite of what you're saying, is that it's actually, it just stays exactly where it is.
Right.
And so that's actually why you have that modulation. That's what's actually preventing that retraction, is because the filler is not going anywhere.
Okay.
So instead of you retracting back, you are just stuck because of that filler.
Yeah.
So that's one of the great things about it, is that because it's able to just keep you in place, is what causes that that lack of retraction that makes you longer when you're flaccid.
Yeah.
Yeah.
So talking about what you do to the scrotum as well.
Yeah.
And are straight people as bothered about their scrotum?
So the way that scrotum filler, or my trademark name ScroFill, started was actually